This is a huge problem with K. Thank you for sharing your experience about getting a huge dose in ICU, having a near-death experience, and having it be really traumatic. This happens to people a lot, and I think we need to talk about it more. If you're going to be looking into K for antidepressant or pain treatment, which are two of the places where it shows the most help, you really need to make sure you have a good vibe with your provider, because now that it's a hot thing, that's an easy way to make money, and these places are charging thousands of dollars for like a couple of grams, then you have a lot of people who are just in it for the payday and who are not good at holding space. And as you can imagine, you really need a lot of help holding space when you have a psychedelic dissociative. I remember talking to a nurse friend at Burning Man as we were watching people use this substance. And she worked at a children's hospital. And if you don't know, K is used at children's hospitals and for old people because it doesn't depress the respiratory system like typical anesthetics do. And so it's very safe for those delicate lungs. The reason that they don't use it for everybody is what they call emergent effects, which is really the scientific name for people emerging from a K-hole after they were having a surgery of some kind. So can you imagine having a hugely deep K experience and then you come out of it in a hospital room with a wound in you from a surgery with people who just don't get it, who are not good at walking you through it, who are not good space holders? It can be such a traumatic thing. It's why I wish everybody who was administering this substance was a nurse who goes to Burning Man and really gets it. Her talking about how she talked those kids through it, what it was going to be like for them coming out of it, and how confusing it was going to be, but them at least knowing what was coming, I'm sure staved off so much trauma. So all this to say, amidst this gold rush of exploring K, be very careful who you get in bed with, and talk to people who have been there. Read the negative reviews. Those are going to be the ones that really show you how they handle a hard situation, because it is the substance doing the work. It is not the provider, more than for most substances. But your provider needs to provide a safe, warm space where you feel good going in and you feel safe coming out.